Magandang umaga mga ka-followers! Isa na namang Usapang Pangkalusugan ang hatid sa atin ng Sagot Ka ni Dok. Ngayong umaga ay sasamahan tayo nina Miss Natasha Claudia Bautista at ng ating resident doctor at host, Dr. Rebecca L. Castillo.
Isa na naman magandang araw sa ating ka-followers. I am Tash Bautista and together with me is Dr. Mary Lauren Europa.
Yes.
And we are your hosts for today's episode of Sagot Ka ni Dok.
Oh, I know the blurb said na we will be with Dr. Rebecca Castillo today, but si ma'am is absent because of some medical issues. So ma'am, sige po, I hope you get it sorted out soon. We miss you po here at Sagot Ka ni Dok. Good morning, Ma'am Tasha.
Good morning, Doctora. How are you today?
Okay naman. Another nice, we have a very nice weather today for this Friday. Tapos
Yes.
medyo na-miss ko rin na doing SKND, 'di ba? Parang bibihira na lang tayo nagta-tandem lately. So, but very timely that I was tasked to do this at a moment's notice kasi very close to our hearts, literally.
Yes po, literally.
Literally a heart topic, 'di ba?
Yes,
Ang ating makakasama ngayon ay isa sa dati ng bahagi ng SKND family. If I'm not mistaken, my first episode I think for SKND si Doc yung speaker noon, no? 'Di ba? We go a long way back.
Opo, Doktora. So ayun po, saktong-sakto din kasi it's the first episode of the month and we are at the end of the year na po. December is our, as bilang mga Filipino, we love to celebrate, we love to eat with our families. But meanwhile, we want to enjoy Noche Buena this December. But, we also want to monitor our health and keep ourselves healthy even though, So, saktong-sakto po yung topic natin, no, Doktora?
Okay, tulin ng araw, di ba? Yan, Pasko na naman.
So, yun po, Doktora. Our topic for today is acute coronary syndrome, sintomas at anong gamutan. So, saktong-sakto po kasi 'di ba sabi nila Doktora, heart problems po or cardiovascular problems po yung main cause of death po sa mga Filipino. So hopefully we can share knowledge po to our fellow viewers today to keep them healthy.
Pag sinabi
po.
kasing acute coronary syndrome, yan yung dapat tinitake natin as an emergency, di ba? It encompasses heart attack. Ayan. So, yan ang alam ng lay people, no? They call it heart attack. So, dapat alam natin kung paano natin pagmatyagan at ma-observe natin, ma-catch natin immediately kung ano yung mga signs at kung kailan tayo dapat mag-seek na ng emergent medical attention. Okay?
Yes,
so,
Doctor. I agree.
Before anything else pala, let's have a short prayer to start our episode.
So, let us put ourselves in the holy presence of the Lord. Okay. Ayan, amen po. So, I hope po we are all guided for today's episode po. And again, for our followers, if you know anyone that has, a bit of a heart problem na or gusto natin maiwasan ang heart problems, feel free to share, like, and subscribe to Sagot Ka ni Dok. lalo na po for
Mm.
today's episode. So,
Yan.
ayun.
So we have a Facebook page at meron din tayong YouTube channel
Yes,
already. So
Doctor.
maaring panoorin ang mga previous episodes pa para tayo lalong maging maalam sa ating mga common diseases. Okay, Ma'am Tash, do the honors of introducing
Ayan.
our SKND
Thank you, Doctora.
special speaker for
Yes po. Thank you, Doctora. So, as you mentioned earlier, our speaker for today is another familiar face and a very active member of the SKND family. Our speaker for today is Dr. Andre Lawrence Tojino, a distinguished internist and interventional cardiologist with extensive clinical, academic, and research experience. Currently, he practices in several top institutions, including Adventist Medical Center Manila, St. Luke's Medical Center Global City, and the University of Perpetual Health Medical Center. Dr. Tojino completed his internal medicine residency at Adventist Medical Center Manila, where he also served as chief resident, followed by a fellowship in adult cardiology and a clinical research fellowship in interventional cardiology at St. Luke's Global City. He is a fellow of the Philippine College of Physicians, fellow of the Philippine College of Cardiology, and a member of various professional societies, including the Philippine Society of Cardiac Catheterization and Intervention. Beyond clinical practice, he is actively involved in medical education as a visiting professor in internal medicine and a member of multiple training and research committees, helping shape the next generation of cardiologists. He has also presented numerous complex cardiology cases in international conferences, showcasing his expertise in advanced interventional techniques. So he's definitely the right man for this episode. Let us all give a warm SKND welcome to Dr. Andre Lawrence G. Tojino. Yan. Hi, Doc.
Hello.
Hello,
Welcome
good
back
Welcome
morning.
back
po.
po, Doc.
Good morning. Thank you, Natasha, for that kind introduction. And Dr. Lauren, it's nice to have you back.
Yeah.
So thank you again for having me. I think my last guesting here was last year, December also. So my
Ah.
topic will be something that is very close to my heart as an interventional cardiologist. So I see a lot of
Of course.
patients with acute coronary syndrome, and I want to share my knowledge to most people so that they would be able to identify and go to the uh, nearest hospital once they have these symptoms. Okay.
Yes. So, let's
Tamang-tama,
start
Doc.
na, no? Let's just reserve all our questions and mga comments natin for Doc to the latter part of the show. Sige po, Doc, let's begin na po.
Okay. Okay. So, good morning to everyone, to all the viewers of Sagot Ka ni Doc. So, my topic, as mentioned a while ago, will be acute coronary syndromes. Its symptoms and the management and treatment that we can give to our patients. So, acute coronary syndrome, it's actually in layman's term, it's heart attack, but it composes three major diseases. It refers to a group of condition that includes ST elevation MI, or what is the classic heart attack, and the non-ST elevation MI, and angina or unstable angina. So it is a type of coronary heart disease which is responsible for one third of total deaths in people older than 35. So here in the Philippines, as we know, coronary artery disease or coronary heart disease is the number one cause of deaths. And coronary heart disease is the root cause of acute coronary syndrome. So acute coronary syndrome actually is divided to three subgroups, as I've mentioned: STEMI or ST elevation MI, and STEMI or non-ST elevation MI, and unstable angina. So we can differentiate the three subgroups based on the ECG and the troponin markers. So what is it? So as a background, acute coronary syndrome occurs when the flow of the blood to the heart is blocked. So the blockage is most often a buildup of fat, cholesterol, and other substances, which form a plaque in the arteries that feed the heart. Okay, so uh, next slide, please. So as I've mentioned, it is caused by blockage of the coronaries. So the blockage is most often a buildup of fat, cholesterol, and other substances. And when once this ruptures, this would cause acute coronary syndrome or a heart attack. So it's very important to diagnose acute coronary syndrome right away, because timely intervention will be really life saving for these patients. So my lecture this morning would be focused on the interventions such as angioplasty and fibrinolytics on this group of patients. Okay. So the blockage of artery. So during a heart attack, what occurs is a plaque that can rupture and spill the cholesterol and other substances into the bloodstream. So a blood clot forms at the site of the rupture. And if this clot is very large, it can block the blood flow through the coronary artery, starving the heart of oxygen and, and nutrients. And this is what we call ischemia. So when there's blockage on the blood flow in the coronary arteries, then this would cause ischemia. And once there is ischemia, this would cause total obstruction in the blood. Once there's total obstruction in the blood flow, this would cause myocardial injury and eventually infarct, or what occurs during a heart attack. So, what are the risk factors for uh, coronary heart disease or acute coronary syndrome? So there are a number of risk factors. So number one, edad, or our age. So as soon as we reach the age of 40, this is already a risk factor for having acute coronary syndrome. Another is smoking or yung paninigarilyo. Having a high cholesterol, especially bad cholesterol and high triglycerides, is also a risk factor for building up plaques in our coronary arteries. So not just in the heart, it can build up in our peripheral arteries, yung sa legs, sa arms natin, even in the brain. Other risk factors are common, such as hypertension and diabetes, which is very common here in our country. So not even here in the country, actually worldwide. Another risk factor is obesity or yung labis na katabaan, which is coronary heart disease. And physical inactivity, another risk factor. So in physical inactivity, usually sedentary lifestyle. If we don't move around, we don't exercise. So this is also an established risk factor for coronary heart disease that can lead to acute coronary syndrome. Another important risk factor is having a family history of a heart attack. If we have a close relatives such as our siblings, parents, uh, that is aged less than 55 in male patients and less than 65 years in female patients, then this is also a risk factor for having coronary artery disease leading to acute coronary syndrome. Other risk factors that are well established is use of drugs such as amphetamine and cocaine. Okay, so in summary, these are the risk factors. So it's very important to identify them and to treat them so that in order to prevent coronary artery disease that can lead to acute coronary syndrome. Okay, so now what are the symptoms of acute coronary syndrome? So, as I've mentioned, acute coronary syndrome, it's a syndrome involving subgroups such as ST elevation MI, non-ST elevation MI. So most of the time, their symptoms are very similar to each other, and the number one symptom is chest pain or discomfort. Other symptoms includes pressure or tightness, squeezing, heaviness, or burning sensation, not just in the chest, even the epigastric area. Now, chest pain that is increasing in severity and longer than 20 minutes is a sign that we might be having acute coronary syndrome, especially those occurring at rest and those that is not relieved by pain relievers or uh, medications for the heart. Okay. Other symptoms that are common are the chest pain equivalent. So, what are these chest pain equivalents? So, not just chest pain, patients with acute coronary syndrome can have diaphoresis, epigastric pain, or indigestion. Shoulder pain, pain in the left or right arm, also can cause acute coronary syndrome. This is one of their symptoms, as well as dizziness or syncope, jaw or neck pain, and shortness of breath, palpitations, and fatigue. Okay. Now, once we have this ACS presentation, it is very important for the patients to go to the nearest health facility, such as clinics, hospital, in order for them uh, to have ECG. So, as I've mentioned, acute coronary syndrome is diagnosed through the ECG, history PE, as well as the troponin levels. Okay. So once we have a working diagnosis of ST elevation MI or non-ST elevation MI, then intervention is very crucial for these patients. Since once we are able to differentiate what is ST elevation MI from non-ST elevation MI, then we could give the appropriate management, and this will be very life-saving for these patients. Okay, so one of the, as I've mentioned, HS troponin or troponin I is the blood marker for acute coronary syndrome. Okay, so can you flash the next slide, please? So HS troponin or troponin I. So this is a blood marker. It's only extracted from our blood. And once patient has chest pain, or ACS symptoms in the nearest in the emergency room, this is one of the blood tests that should be taken right away, since this would be very crucial if we'll be doing some intervention or angioplasty for our patients. Okay, next slide. So once we have acute chest pain, so as I've mentioned, acute chest pain is the number one symptom of acute coronary syndromes. Then we have to be admitted to the ER or the nearest health facility. Then, based on the symptoms and the ECG, we divide them or we subgroup them into either ST elevation MI or non-ST elevation MI. So once patient have ST elevation MI, which I'll be having a few slides to demonstrate ST elevation MI from non-ST elevation MI, then we don't have to wait for the troponin level. Once patients are diagnosed with ST elevation MI, we go straight to the cath lab if we're in a cath lab capable hospital, or we give them fibrinolytics in hospitals that have no cath lab. Okay, next slide. So, as a review, this is the normal ECG. So here in the slide. So in ST segment elevation MI, what happens is that this QRS segment, this is the QRS, then the T wave here, as seen in this slide. Once there's ST segment elevation, and now we can diagnose patients having STEMI. Now, for non-ST segment elevation MI, their difference in the ECG, instead of the ST segment elevation in non-ST segment elevation MI, there is usually ST segment depression, as seen in this right side of the ECG, as well as there is T wave inversion. Okay, so now once we are able to differentiate ST segment elevation from non-ST segment elevation MI, then we go to the next treatment protocol. So as I've mentioned, once there's ST segment elevation MI, time is very crucial. We usually send patients right away to the cath lab for them to undergo coronary angiogram and possible angioplasty to open up the blocked arteries. Now, for non-ST segment elevation MI, meaning there is ST segment depression or just T wave inversion, we have some luxury of time for these patients. So we don't need to send them right away to the cath lab. However, in the next 3 days, the possibility of doing an angiogram should be considered, especially if the troponin is very high. So in non-ST segment elevation MI, we wait for the blood marker troponin. Now, once it is high or rising, then we advise patients to undergo a coronary angiogram, as well as continue with the medical treatment for these patients. Okay, so for the next slide, I will be discussing now. Once we diagnose ST elevation MI in PCI capable center, what we usually do is there's usually a cath lab team, and once the STEMI team is activated, the goal here is to open up the blocked artery within 60 minutes. So we do coronary angiogram. Once we identify there is a culprit lesion, we put a wire in the coronary artery and try to open up the blocked artery with a balloon and eventually put a stent. Okay, so next slide, please. Okay, so That's what. So in this diagram here, once there's ST elevation MI, we activate the STEMI team and we do primary PCI or angioplasty. Now, the question is, not every hospital here in the country has a cath lab. Especially majority of our hospital does not have a cath lab. However, majority of our hospital has a ER and an ER team that can identify ST elevation MI or a heart attack that is occurring. So in these patients, fibrinolysis is very important. So fibrinolysis is treatment for heart attack that we can give through the IV. And what does it do is it usually we give IV medications through our veins. And what this fibrinolysis medications will do is it would lyse the clot. It might not lyse the clot completely, but it would partially lyse the clot for it to reestablish blood flow. Once fibrinolysis is successful, then there will be ST resolution, or what there will be improvement in the ST segment elevation. Then we can decide later on if there is a need to do further coronary angiogram. Okay, next slide, please. So these are examples of fibrinolysis. It is very readily available in most ER in our country, most hospitals. So even if there is no cath lab in the hospital that we go to, this fibrinolysis is very crucial and life-saving for those patients who are undergoing an acute heart attack. Okay, next slide. Now, if we like I've mentioned, if a heart attack is diagnosed and we go to a hospital that is there's no cath lab, there's what we do here is that we can send the patients once we diagnose them and give fibrinolytics, then we can send them to the nearest hospital that is cath lab equipped. So for in order for us to do an angiogram right away. Okay. Next patient. So this are what I'm discussing is the protocol. So this next slide for non-ST elevation MI, the protocol, as I've mentioned, in ST elevation MI, it is very important to bring the patient right away in the cath lab or to give IV fibrinolytics to help lyse the clot, and for in order for the patient to reestablish the coronary blood flow, then we can send them right away to the nearest cath lab hospital. Now, for non-ST elevation MI, time is there we have enough time to give medications. And in non-ST elevation MI, we divide patients based on their risk from low risk to very high risk. So for very high risk and high risk non-ST elevation MI, we usually proceed with a coronary angiogram, not right away, but within 24 hours. So for those very high risk, the guidelines say that we should bring them to the cath lab in less than 2 hours, while for those high risk, we could bring them in less than 1 day. Now, for those who have no high risk features, meaning they're very stable, chest pain has resolved, troponin may be elevated, but it's not increasing, then we classify them as intermediate risk for cardiac events uh, in the future. So for these patients, we could wait to do the angiogram in the next 3 days. But important thing is, even in non-ST elevation MI, guidelines would suggest that bringing them to the cath lab right away to open up the uh, culprit or non-culprit artery is life-saving as well to this patient, especially non-ST elevation MI patients. These are patients that have more comorbidities based on what we see in the community. Okay, so for our next slide, so I have discussed the protocol for ST elevation MI and non-ST elevation MI. So in summary, once we are able to diagnose ST elevation MI or non-ST elevation MI, part of the acute coronary syndrome group, then early invasive angiography is uh, the standard treatment for these patients. Now, additional treatments that we could do is we could do echocardiogram to check for heart failure. We could do other imaging, as I've mentioned, do serial ECG monitoring, as well as do troponin monitoring. Now, further management, as I've discussed, these patients can undergo angioplasty. If there is three vessel disease, then we deck them to do bypass surgery. Now, in addition to this revascularization techniques, it's very important to give them long-term medical treatment. So we usually give them aspirin, blood thinners, clopidogrel, and beta blockers or angiotensin receptor inhibitors or blockers, which are uh, medications that are given to heart failure patients, to hypertensive patients who have undergone acute MI, and these medications are also life-saving and improves mortality for this subset of patients. And aside from these medications, we could give them lifestyle modifications such as smoking cessation, alcohol cessation as well. Okay, so for our next slide, so I'll be this next slide. I'll be showing a video of what a coronary angioplasty procedure is uh, is being done to acute coronary syndrome patient. Okay, so we'll play the slide. So this would be just a few minutes, about around 3 minutes. So coronary angioplasty or an angiogram is what we do here is that we usually this is a heart procedure that is very non-invasive. We usually uh, put a small catheter in the wrist or in the groin of our patients. Then once we put the catheter, then we inject a dye, and then we go through uh, the procedure by like taking pictures of the heart, and if there is blockages in the heart, then we could do balloon angioplasty and eventually do drug-eluting stent implantation. Okay, uh, is the video playing? Okay, uh, okay, I think the video is not playing. So uh, percutaneous. So we go now to a case here. So example of an acute coronary syndrome patient. We have a 49-year-old male with chest pain. So in this patient, as you could see the ECG here, the ECG shows ST segment elevation. So this patient is a 49-year-old male who is non-hypertensive, non-diabetic, but only has high cholesterol. So as I've mentioned, a risk factor for acute coronary syndrome is dyslipidemia or high cholesterol. Okay, next slide. So for next slide, here is an angiogram of this patient. So in the angiogram, uh, is- okay, I think it's not playing. So okay, we can skip with this. Okay, so basically, an angiogram. What I'm showing these slides is that in acute coronary syndrome, this is a ST elevation MI. There is blockage of the artery. There's total occlusion. So what we do here is we do immediate angiogram. So once we were able to identify block arteries in this patient, we open the block artery by putting a wire right away and eventually a stent. So in this patient, next slide, please. Thank-
Ayan, it seems we're having some technical difficulties on the end of our speaker. So while we wait for him to come back, may we request our audience to please leave your questions in the chat box below so that we can relay them to Doc after his discussion. So ayun, our apologies again. So we hope everyone is um, patiently waiting and listening attentively to the discussion of Doc.
Ayan. O sige.
shucks.
Hi, Ma'am Tash. Yun na nga. We
Hello.
have
Ayun.
encountered technical
Hello.
difficulties.
Ay,
Sorry.
naku si Doc.
We're
It's
at,
okay, Doc.
okay. Sorry of the connection here. Uh, okay, we're able to play the last slide, the angiogram. Okay. So basically, Here is an angiogram of the patient, so we're able to reestablish the flow. So what in a heart attack or a ST elevation MI is important is to reestablish the flow, since reestablishing the flow would help us improve the myocardial infarction or the muscle injury that is happening. So once this occur, we can reestablish the flow, and the muscle would be prevented from infarcting or dying. Okay, so next slide, please. So here's the ECG. So as I've mentioned, as I've shown a while ago, uh, the ECG in this patient a while ago, it has ST segment elevation. So once we're able to do angioplasty, reestablish the flow of the blocked artery, the ECG showed resolution of the ST segment. And in this patient, chest pain resolved, and he went into recovery in the next 3 days. So that is why it's very important for acute coronary syndrome patients, especially ST elevation MI, to undergo immediate or primary percutaneous coronary intervention or angioplasty right away. Since in this patient, time is very important. As we say, time is muscle. Once we reestablish flow, the quickest possible time, less than 90 minutes to be exact, based on the guidelines, then the recovery of these patients would be very good, and mortality would be lessened, especially in this subset of patients. Okay, next slide, please. Now, there's good news actually. I know coronary angiogram, especially for acute coronary syndrome patient, and angioplasty is very expensive. So the cost here is around 300 to 700,000 pesos, depending on the number of stents deployed. But since last year, December, PhilHealth, our national insurance, launched the acute MI benefit package for acute coronary syndrome patients. So this PhilHealth package would cover, as I've mentioned, fibrinolytics in those hospitals without a cath lab for STEMI patients, coronary angiogram, as well as the primary angioplasty or the stents for patients undergoing angioplasty. So this includes STEMI and non-ST elevation MI. So in addition to coronary intervention, it also covers for ambulance transfer to cath lab hospitals, as well as cardiac rehab post-angioplasty. Okay, so next slide. So the field health usually would cover around, if we do angioplasty, can you show the next slide, please? Next slide, please. So here is a summary. So this field health package would cover for coronary angioplasty, or what we call percutaneous coronary intervention, around 520,000 pesos. For fibrinolysis, or what we call IV fibrinolysis, what we can give in the ER, for patients who are awaiting an angiogram or transfer to a cath lab hospital, usually PhilHealth would cover around 150,000. While for the emergency medical services, they could cover 20,000, as well as cardiac rehabilitation. So in this package, once you have SC elevation MI, non-SC elevation MI, cardiac rehab would be covered like 6 to 10 sessions. Okay, next slide, please. Now, this is just a summary, the difference between acute coronary syndrome and a heart attack. So basically, acute coronary syndrome involves a heart attack. But in a heart attack, the presentation is usually sudden. But in acute coronary syndrome, such as non-ST elevation MI, their presentation could be subtle. Sometimes the chest pain could be gradual, and the management would be different between the two. So as I've mentioned, in ST elevation MI or a heart attack, we need to bring them right away to the cath lab once they are diagnosed in the ER. While in non-ST elevation MI, we give them usually medication first, such as thrombolytics, antiplatelets. Then we schedule them for a coronary angiogram in the next few hours, up to 3 days. Okay, so this is the summary of acute coronary syndrome. Okay, next slide. So this is the Christmas season. So as mentioned by our host, right now we are in the holiday season, and we become very busy with buying gifts, attending Christmas party, and it is very important uh, for us to identify the risk factors of acute coronary syndrome in order for us to prevent them from happening. So this Christmas season, studies have shown that there are more heart attacks that occur this season than any time of the year. And research shows that more people die from heart attacks during the last week of December than any time of the year. So as I have mentioned, the holidays are very busy, often stressful time for many of us. Routines are disrupted. We tend to eat and drink more and exercise and relax less, as well as we gain too little sleep and relax less since we are very preoccupied buying gifts, going to Christmas parties, attending so many Christmas parties. Okay. So what is important is prevention. So in this next slide, the American Heart Association, or even the PHA, which is the leading organization focused on heart health, says that being aware of this annual phenomenon and taking a few important heart healthy steps may save our lives. We also may not be listening to our bodies or paying attention to warning signs, thinking a trip to the doctor can wait after the new year. So it is important to be aware of all risk factors because this can be snowballing contributors to increasing the risk for a deadly heart attack. Okay, so for my next slide, lifestyle modification is very important. Aside from the treatment and management that I've discussed, lifestyle modification is as equally important as what I've mentioned a while ago. So maintaining a healthy weight with a heart healthy diet, not smoking, exercising regularly, managing our stress, as well as controlling our risk factors or conditions that can lead to a heart attack, such as high blood pressure, high cholesterol, and diabetes, would be really life saving for most of our patients and our population. So I think that is my last slide, and healthy holidays to everyone. Thank you for your kind attention.
Thank you, Doc Andre, for a very comprehensive discussion on ACS po. So, ayun,
Marami pong
Doktora.
salamat. Yeah, yes. Oo nga, maganda yung greeting, no? Healthy holidays, ganun na lang.
Opo. Yeah,
Kasi
we
'di
should
ba?
use that from now on. Healthy holidays po.
Healthy holidays. Sige, Ma'am
Yun, Doc.
Tasha, do you have any questions with you?
Yes, Doc.
Kasi I
Actually, I
think
have some questions po. Lalo na, I've been seeing online, Doc, kasi, na some people are asking questions na, is there a way or any sign or symptom po, like you can tell beforehand bago ka magkaroon ng heart attack? Kasi some people say usually, they feel na sa simula pa lang ng araw, pagod na sila, maya-maya, or dehydrated, tas later on within the day, may heart attack pala sila. Is this a myth po, Doc? Or is there actually some signs po that can, we can remind our viewers po to watch out for?
Yes, definitely there are signs and symptoms, subtle signs actually for most of the patients. But for a classic heart attack, they would immediately experience yung mga sudden chest pain, sweating, jaw pain, arm pain. But for, as I've mentioned, acute coronary syndrome, majority of this is not a ST elevation MI or classic heart attack. So most of these patients will undergo non-ST segment elevation MI. So in non-ST segment elevation MI, usually common to in female, elderly patients, those with a lot of comorbidity. Sometimes they would present with not chest pain. Sometimes they would
yung
have
bloating.
stomach pain or just sweating or dizziness. Sometimes loss of consciousness or pre-syncope. Parang mawawala ng malay. It's also a sign. So these are signs that we should identify, or we should, once we experience these symptoms, we should go to our nearest doctor or nearest hospital right away, especially if they are recurring and occurring frequently.
Thank you,
Okay.
Doc. So in relation po, our title kasi for today's episode is Sintomas at Anong Gamutan. So you mentioned earlier today yung cabbage po, right? So now po, my question is, for those po that nagkaroon na ng heart attack or may heart
Yes,
condition na
bypass.
po, yes po, bypass po. Is there a way po na makaka-recover po sila without medications, or kailangan po talagang may medications, Doc? Syempre kasi medyo pricey nga po yung ating mga gamot, right?
Yes. Yes, important actually in a heart attack. Aside from what I focus right now in the revascularization, like angioplasty or bypass. Once we are done with this procedure, yung mga medications are very important. So hindi ibig sabihin nagawa na yung angioplasty na bypass wala na tayong inumin. Since especially for bypass patients or angioplasty patients, naglagay tayong stent, there is a risk for this patient to have yun nga,
Stenosis.
blockage stenosis, mga in-stent stenosis.
Oh,
Ayun.
sige. Sige. Dadagdagan ko
Doktora.
na lang, no? Yung mga stent natin, pag iniwan mo yan, syempre, you have to think of it as a foreign body. So, meron ka talagang iniinom na medications, no? Dual antiplatelets para hindi magbuo uli yung tawag dito, yung ano yung Tagalog nun? Yung pagbabara, yun, yung bara doon sa ugat na nilagyan mo ng stent. So, very important, especially for those who are post-angioplasty. Kailangan nilang uminom ng mga gamot. Ano pa ba yung question mo, ma'am? Sorry.
Ayun po. So I was going to add to that,
Ang galing yung
Doktora.
thought
Thank
ni
you.
Doc.
Mabuti na lang po cardiologist ka din, di ba? Very,
Yeah.
very timely po. So
I'm
yun,
pretty sure,
Doktora.
Ma'am Tash, familiar ka din with all these things. Bilang, di ba, you come from a medical related background, which is pharmacy.
Opo, Doc.
Okay, so,
But for our viewers, Doktora, may I ask po, syempre we, here in SKND, we promote po healthy lifestyle, eating fruits and vegetables. But
diba,
apart from
mostly
that po, are there
pare-pareho naman yung
any,
mga advice namin lahat, di ba? So,
opo, are
we
there
have to stick
any
to
food supplements or specific vegetables that we should look out for po to prevent the heart condition and to alleviate po yung after the
Ayan na,
condition.
Doc
Ayan na
is
si
back.
Doc. Hi,
So,
Doc.
Sorry for the technical. The
It's okay
internet
po. It's
very
okay,
weak.
Doc. Don't
Oo,
worry po.
na-cut off
ay,
ako. So yun nga, as na-mention ni Dr. Lauren. So yeah. So kailangan medications very important like after an heart attack or even after a bypass, the aspirin, clopidogrel, we should continue then. Especially for heart attack patients na underwent angioplasty at least a year for this dual antiplatelet. Tapos we start with statins, yung anti-cholesterol medications, as well as beta blockers and ACE or ARBs or yung mga BP medications. These are also very important for post heart attack patients, especially in those with some heart failure after a heart attack. Okay.
tsaka yung mga ano nila, yung mga comorbidities nila that are also risk factors. Like, if they have diabetes, kailangan yung mga dati nilang gamot, i-maintain pa din. Diba? Hindi naman, it doesn't fix everything. You have to continue your medicine after the procedure. Doc, I think yung next question ni Ma'am Tasha was regarding diet and are there any supplements that could be taken para para hindi ma-prevent yung onset ng acute coronary syndrome?
No, tama po.
Yes, of course, diet. Especially a lot of these patients, sometimes they have yun nga, high cholesterol, high blood pressure. So important for these patients, low salt diet. So yung recommendation nga, I think less than 2 grams ng most of the heart associations or yung mga
Doktora.
Ayun, meron tayong what you call your DASH diet, 'di ba? It's easily googleable, no? You can Google it, DASH, no? Dietary approaches to stop hypertension. That will also be very good for our patients na ganito, no? At risk for having acute coronary syndrome. Bukod doon, they can also Google the Mediterranean diet, kung ano yung mga kalahok na mga pagkain na nandoon at kung ano ang mga dapat nating iwasan. Yun na, we normally, we keep on saying it here sa SKND, di ba? So, low salt, yung mga matataba at mamantikang pagkain, bawasan din. Anything in
Hello?
excess, like sugars, ganyan, they get converted into unhealthy substances later on na masastore sa body natin. Doc
Hi,
is
Doc.
back.
We love this cardiologist tandem, this power duo cardiology tandem.
Okay
Timely,
ba?
very timely.
Parang
Buting-buti na
naka-fix
lang.
pa rin yata si Doc eh.
To our
Hello.
followers, we ask for your
Sorry, nawala
understanding
ulit.
po.
Can you hear
Data
me
po si
again?
Doc.
Yes,
po,
Doc. Opo,
Okay na
pwede
po.
na, okay na po ulit.
Yes. So,
Ayan. Ma'am Tash, perhaps
ayun.
we have room for one or two more questions na lang in the interest of time. May clinic pa
Yes
rin
po.
kasi si Doc.
Opo.
Ayan,
Ayun,
sige.
Doc. So,
Yes, I
ayun,
have
thank you
clinic
again
pa.
for
Yes.
for still staying
But
with
it's
us
okay.
despite the internet connection po. So, ayun. Another question po, Doc. For those na have already occurred na po yung heart condition nila or yung kunwari heart attack, tapos na po. What are the specific things to avoid and what should they do to improve yung heart condition po nila? Is there a way to bounce back po to their previous quality of life?
Yes, of course, especially those who have had a heart attack. Important, as I've mentioned, cardiac rehab. So these patients can enroll in cardiac rehab program. Part yun ng protocol actually in most ST elevation or even the NSTEMI patients. So after doing intervention, we enroll them for cardiac rehab programs. So they usually exercise mga exercise activities that is guided yan with doctors, yung specialists also, cardiologists as well. And of course, diet, low fat, low salt diet, exercise as in addition to cardiac rehab. Actually, yun nga yung what the program is doing to build up stamina and
Ulit tayo. So, okay. In
And
addition to that, mga bad habits natin. Remember, I think Doc earlier on sa first few slides ng lecture niya mentioned that smoking is a risk factor. Tapos parang sinabi pa yata the use of recreational drugs like cocaine. Ano ba yung mga nandun kanina? So anyway,
ketamine po.
so yun. So if
Ayan.
we are guilty of all these bad habits, siguro it's time for a lifestyle overhaul. 'Di ba, diet, exercise, at syempre lifestyle din. Sabi nga nila, sitting is the new smoking. So maglakad-lakad at tayo'y
ayun,
kumilos-kilos. Okay? Ayan na, Doc
Ayun,
is
hi,
back.
Doc.
Medyo
ayun. Sorry,
cha
can you hear me
Thank you, Doc.
last
Onti
time?
na lang po.
Hopefully, this
Opo.
will be
Onti
the
na lang,
last
Doc. Opo.
disconnection.
yeah.
Ayun, Doc.
Doc.
So,
Go
tama
ahead
po,
po.
Doc.
I'm back
Dapat,
with a weak connection.
it's okay,
Uh
Doc. Thank you po. So, Doc, we
yes.
wanted to clarify, tama po ba we should focus on more cardio-related exercises like walking, brisk walking, jogging po. Is that correct, Doc? Yes. Yes.
Hindi yata as tolerated naman, Ma'am Tash, kasi siyempre pag
Okay.
kaka-heart attack mo lang, 'di ba? Do not jog extensively or excessively rather. So
Yeah.
yun, brisk walking, siguro walking every day at least 30 minutes will do. Ang sabi nga, 'di ba, the recommendation is at least 150 minutes per week of moderate intensity exercise. Ganyan. So hindi
Tama
pwede
po,
yung lakad-lakad
Doctor.
lang sa mall na ano. Medyo we have to get our heart pumping a little bit more than the usual. Tapos yun, siguro 30 minutes per day. Basta, however you want to budget it, yung 150 minutes a week. Basta lang daw, hindi hihigit sa 2 araw na naka-rest day ka. Di ba? So,
Opo.
ganun. Yun ang
Yung cheat
sabi.
day, Doktor, lalo na ngayon,
Day
dadami
sa
ata
ano.
yung cheat day ng December. Yun po,
I know,
Doktor.
right?
So, I think in the interest of time po, ayan, thank you to Doc Andre po for
Yes.
sharing with us his time, his knowledge, and his
Thank you so much.
patience po
Super, ano pa naman,
despite the
super
internet
pangalanon,
connection.
super busy pa naman ni Doc. Okay, so thank you for for lending us your time this morning. Okay, Ma'am
Yes,
Tasha.
and Doctor, thank you to you also na nakakasalo po kay Doc
Yeah,
Andre
oo.
despite the
Wala
connection po.
tayong choice, ganun talaga pagka live program. Okay.
Opo, ayan. So, again, thank you to all of our viewers for joining us in today's episode. At sa mga hindi nakapag-subaybay po ngayon, pwede po natin panoorin ang ating episode sa sa Facebook page natin, Sagot Ka ni Doc. Also, may YouTube na rin po tayo. So,
Yan.
we wish everyone a healthy Christmas, a healthy holiday po.
Yeah. I'm
And,
not quite
ayan.
sure if meron pa tayong episodes for the next couple of weeks before we usher in the new year. Pero sakaling wala, Merry Christmas and a Happy New Year to all our SKND followers. Hopefully, we still see you in the remaining weeks. Pero kung wala po, kami po nag-extend na ng aming greetings, and sana po lahat tayo ay maging malusog, masigla at masaya nitong nalalapit na Pasko at saka sa ating bagong taon. Okay? Yan.
Ayan. So, thank you po. Merry Christmas. Happy holidays. Healthy holidays po.
Happy
And
holidays. Ayan.
much
Dr.
love po from
Becky,
the
miss you po.
from the
Okay.
SKND family, especially from Dr. Becky po, who misses the program very dearly.
Ayan na, si Doc.
Si
So, he
Doc.
can siguro say,
Bulaga.
he can,
Mga final messages po ni
final
Doc
messages.
Andre, if ever.
Ayan na. Yun
Yun
talaga yung
drum
difficulty
roll.
kapag live. Hindi mo
Opo.
ma-predict. Minsan, okay yung signal.
Lalo nang may
Sorry
clinic po si
again.
Doc. It's
Ayan
okay,
na.
Doc. Ayun, thank you so much, Doc, for still striving to join us
Can you
today.
hear me once again?
Yes
Opo.
po, Doc.
Doc, we'll just
Loud and
ask
clear.
for your final words at saka ang parang take-home messages na lang for our viewers.
Naglalag po ata.
Okay. So my final message is acute coronary syndrome is it's basically a heart attack. So it encompasses 3 subgroups, STEMI and STEMI. And as I've mentioned, it's important to identify the risk factors, the symptoms, since timely intervention is very life-saving for these patients. And lifestyle modification and medications is important in the long-term treatment of these patients. Okay.
Thank you again, Doc
Thank you
Andre.
again, Doc.
And
Doc,
good luck po sa
happy
clinic.
holidays. Yeah.
Happy holidays po. And
Oh.
ayun po, Doc, we won't keep you longer na po so that you can proceed po to your clinic. Again, thank you so much po for joining us today and for imparting your knowledge, Doc.
Thank you once again. Maybe next time we'll make sure the connection is
Yes.
No
well
worries po,
connected.
Doc.
Okay.
Sige po, Doc.
So thank you.
Doc Andre, thank you. Thank you po.
Healthy
Bye,
holidays to
everyone.
everyone.
Stay
Happy
safe
holidays
po.
to everyone.
Happy
Bye.
holidays.
Bye-bye po.
Ang pag-uusapan po natin ngayon ay tungkol sa tubig or water or H2O. Ito ay inorganic compound composed of 2 atoms of hydrogen and 1 atom of oxygen. Usually, it's a liquid form, sometimes solid, kagaya ng ice, or vapor or steam. It is usually tasteless, colorless, and transparent. So, gano'n ba kalaga ang tubig? Sa mundo natin ay at least 70% ay tubig. No? Tapos majority niya ay sa ocean. 3% na fresh water na. Pwede natin kunin. Ngayon sa human body, adult, ilang porsyento ba ang tubig? Napakataas po. At least average 70%. No? So, 70 to 80% water po mula sa brain natin, sa puso, blood, kidneys, livers, lahat yan ay mayroon tubig. So, 70 to 80%, iba mga 20%, pero lahat kailangan ng tubig. So, ano po ba ang kahalagahan ng tubig at ang mga action ng tubig? Isa, tawag natin lubricant, no? Para yung mga joints natin mag-lubricate. Pangalawa, inibigit yung mga nutrients sa kinakain natin. Tapos, pangatlo, dadali na niya sa isa't ibang parte ng katawan. Mula sa ulo, so, tinuturo niya, sa transport niya, ay oxygen. Isa pa, ang 4, ay yung mga toxic waste sa katawan, especially to the kidneys, it's the drive out niya, lalabas niya. No? At marami pa siyang function. Kapaganda rin ang skin, syempre, no? Pag-rehydrated. So, ganun ka-importante ang tubig sa katawan. May national findings na pwede kang walang pagkain, 1 month, pero ang tubig, hanggang approximately hanggang 1 week ka lang pwede mabuhay. So, ganun kataga ang tubig sa atin. So, ano ba mga sintomas pag sinasabi ng kulang sa tubig? Pero huwag na po natin hintayin ito. No? So, ang mga symptoms, isa, sakit ng ulo. Yung malimit yan, ang sakit ng ulo ko. So, isang dahilan ay kulang tayo sa tubig. No? Pangalawa, nag-dry mouth. Dry ng mouth mo, dry ng lips ko, no? Kulang na tayo sa tubig. Minsan yung ihi natin, kumukonti rin, pwedeng sign na kulang tayo sa tubig, no? Tapos dry skin, no? Saka para tayo nangihina, ang ganda ang pakiramdam natin. At sa bata nga, natawag namin sunken fontanelle, sa ating ulo, at yung sunken eyeball. Pero huwag na po natin hintayin kasi pag gano'n po, dehydrated na tayo. So, ilang litro ba ng tubig ang kailangan per day? Pero depende din sa edad, sex, may mas mataas, activity, more energetic, tapos kung masyadong mainit, dahil sa atin masyadong mainit, no? Nakakadagdag, dapat dadagdagan din natin yung ating intake ng fluid. So, ano bang mga liquid natin? So, kahit kung ano, pwedeng spring water, so natin, mineral water, or distilled water, pwede po basta pumakilis, no? O kung nag-water, pwede rin, no? Kung na-avoid na po natin ang mga fruit juice, kasi po malakas ang fruit. So, average, kung natin 2 to 3 liters a day, 12 to 15 cups per day. So, minimum po yun, average. So, depende nga sa activity nyo, pati sa age, no? Sa condition ng environment, pwede mas mataas. So, ano bang magandang schedule? Kasi kanya-kanya schedule ng pag-inom ng tubig, no? So, ang pwede pong gawin natin ay pag-isip sa umaga, minom na po tayo ng 1 or 2 glasses, no? Tapos, in between meals, 1 to 2 glasses, no? Kung ng mga 12 to 15 glasses a day po tayo. Sa gabi po, kung malapit na matulog, siyempre, iwasan na natin maraming tubig kasi magigising tayo pa rin, no? So, ganun po kahalaga ang tubig sa ating katawan. So, kailangan po tayo ay hydrated. So, araw-lalo po ngayong panahon natin na mainit. So, kahit hindi po mainit, kailangan natin inom ng maraming tubig everyday. Unless, so sabihin ng doktor na huwag masyado kasi masakit na puso. No? So, pagka okay tayo, ito po ay isa sa kailangan po natin so we can have a good health and well-being. One way to be healthy is to drink plenty of water. Maraming salamat po.